I'm Nick, and in this video we'll be talking about boric acid and using it to treat a yeast infection. Well, one thing you should know about boric acid is it is safe for non-pregnant women and men who are adults to use. But for pregnant women, if they take boric acid in the early stages of pregnancy, the U.S. government's Medline Plus says this can result in a 3 times greater chance for their baby to develop birth defects. And boric acid is an industrial chemical and it is a poisonous substance, but you can use a safe dose intravaginally to get rid of a vaginal yeast infection. And when you use boric acid, some of it will get into the blood, of course, but it only has a half-life in the blood of about 12 hours. So right after you get done using it, it goes away fairly quickly. So let's take a look at some of the studies that were done on women who used boric acid when they had yeast infections. A 2003 study published in the American Journal of Obstetrics and Gynecology used 141 women who all tested positive for having Candida glabrata induced vaginal yeast infections. The women in the study took 600 milligrams of boric acid intravaginally for 2 to 3 weeks. One group of women taking the boric acid had a cure rate of about 64%, and another group of women had a cure rate of about 71%. The study found that there was no advantage in extending boric acid therapy from 2 weeks to 3 weeks. So a 2-week regimen of intravaginal boric acid use should be about as effective as a 3-week regimen. A 1981 study published in the American Journal of Obstetrics and Gynecology looked at how well boric acid could treat Candida albicans induced vaginal yeast infections. The women in the study took 600 milligrams of boric acid vaginal suppositories for 2 weeks, and they took these suppositories once every day. The study found that about 92% of the women were cured of their yeast infections about 7 to 10 days after the treatment had been ended. The study also included an evaluation that took place 30 days after treatment. At this time, only 72% of the women remained symptom-free. So, how much boric acid should you take? Well, the U.S. government's Medline Plus recommends taking 600 milligrams of boric acid in an intravaginal suppository 1 to 2 times a day. And to prevent recurrent or repeat vaginal yeast infections, Medline Plus recommends taking 600 milligrams of boric acid intravaginally twice a week. Well, in conclusion, yes, you can use boric acid. Both studies that we looked at and Medline Plus recommend using 600 milligrams of boric acid as a vaginal suppository. Now, you probably don't want to go much over this dose, and you shouldn't be taking it for more than 3 weeks because you may end up getting boron poisoning, as boric acid contains the element boron. And of course, don't use boric acid with small children, and especially don't take it while you're pregnant. And if you've been considering using boric acid to get rid of a yeast infection, you may be desperate and have been suffering from recurrent yeast infections for some time. Fortunately, there are natural solutions that work very well, and there is really no need to use a harsh chemical like boric acid. So if you'd like to learn more about some natural therapies to use for yeast infections, you can check out our website, candidahub.com, and there you can learn a lot about alternative and natural remedies to get rid of yeast infections. And while you're there, you can also learn about a 12-hour cure for yeast infections that works very fast and will permanently end recurrent yeast infections and wipe out a systemic yeast infection within a few weeks. Okay, hey, thank you so much for watching. I hope this answered your questions and hope you get better very soon. See ya.